Hello everyone, and thank you for giving me this opportunity to speak with you. My name is Professor Maggie, and I'm the President of the Faculty of Public Health, which is the professional home for the public health workforce. It was a great privilege to have been invited to the Health Mela in April. I was very disappointed that it didn't go ahead as planned due to the pandemic. A Mela is such a fantastic way to celebrate family and community health. It is a great achievement by everyone involved that the Preston Mela has been taking place for nearly 20 years now and has been so well received and recognised. Professor Gupta assures me that the event will take place later this year, and I look forward to being involved. It is a shame that we won't be together face to face for the event. However, we are all getting used to using digital communications. The most important thing is the community coming together to celebrate and reflect on health. Coronavirus and the events of the last 6 months have dramatically changed all of our lives, making it more important than ever to retain a sense of community spirit. It is fantastic that events and celebrations such as the Preston Mela are able to continue to take place, making full use of the technology available to us to remain connected. The way in which both health professionals and the public have responded to the unprecedented events caused by the pandemic is to be commended. As health professionals, we are immensely grateful to the commitment that the public has shown to protecting their own health, that of their families, their friends, and their community. We do not underestimate the sacrifices made by the public, nor the manner in which charities and community organisations have come together to protect and care for the most vulnerable in our society. The public have sacrificed much of the freedoms we enjoy in modern society to combat the virus, especially those who've been asked to shield themselves. The roles of family, community, and local services have never been so important. The public and health professionals alike have risen to the challenge presented by COVID-19 with determination. By following the guidance and continuing to socially distance and isolate where appropriate, we are working together to save lives and protect those we love. It is a testament to the public that following a request for volunteers to help, the NHS in its coronavirus response had over 750,000 people willing to help. In the absence of a vaccine, the only way that we can tackle this pandemic is by the public continuing to demonstrate the responsibility they have shown and to follow instructions to stay safe and prevent the spread of the virus. The virus can only spread if we as human beings let it. The simple message of keeping a safe distance apart, wearing face coverings, and washing your hands still remain key actions. This is even as we start to take careful steps out of lockdown and enjoy some of the freedoms that we want to regain. We must all recognise that the impacts of coronavirus on health and well-being are far more wide-reaching than the risk of just contracting the virus itself. We are witnessing this in the increased reports of poor mental health and increased numbers of non-COVID related illnesses and deaths. Remaining connected in ways that respect the threat of the virus, staying physically and mentally active, and caring for those close to us are all essential in guarding ourselves and our communities from feelings of isolation and anxiety. We see these ideas reflected in the wonderful Health Mela programme. These events encourage a wide variety of activities which enable us to look after our mental health and stay connected with one another. Arts, culture, cookery and craft are all brilliant ways to foster community and good mental health. Engaging young people in health from an early age is vitally important. This is another commendable aspect of the Health Mela, encouraging a community to own its own health and be proactive in staying healthy and mentally healthy is also the key. One of the challenges of COVID-19 pandemic for healthcare professionals has been encouraging people with health conditions, those unrelated to the virus, to continue to access healthcare. While we may have seen the postponement of some routine treatments to build capacity within the NHS, it is important that those with non-COVID related illnesses continue to access healthcare. If you have a condition that you're concerned about, speak with your GP. And if you are invited to a hospital appointment or for screening or immunisation, then please take up this invite. This will be particularly important when the flu vaccine comes along. A Health Mela is about encouraging people to take ownership of their health. There is a fantastic collection of resources to be found on the National Forum for Health and Wellbeing website. This covers a range of issues such as diet and exercise, dementia care, heart disease, stroke, and much more. As President of the Faculty of Public Health, I have been working with our members, the public health workforce in the UK, to influence the development of the response to the pandemic, both supporting and holding government to account. Local leadership now forms the foundation of our response to the pandemic, and we must ensure that these renewed links are used to restore, reinvigorate, and strengthen the public health system at local, regional, and national level. Events such as this Health Mela are so important for fostering collaboration between professionals and the public. It is fantastic that through the wonders of modern technology, we are still able to share ideas and build relationships, even if we are physically apart. Thank you so much to Professor Gupta for his brilliant work, for the brilliant work you do, and for providing me with this opportunity to speak. I am honoured to have been invited to participate in the virtual Health Mela later this year. I look forward to meeting in person in 2021 to celebrate the 20th anniversary of the Preston Health Mela. Thank you so much, everyone.